So today we are looking at brachytherapy, and brachytherapy is a radiation treatment used to treat cancers, and this requires the insertion of radioactive seed into the body near or inside the cancerous tumor, and the seed will emit gamma radiation to destroy the cancer cells. This form of treatment allows for high dose of radiation to penetrate cancer cells as it targets a small area within the body and it lasts for a much shorter time frame. However, due to the radiation, it may diminish the functionality of organs and the nearby organs around the treated site, so precautions are taken to avoid further damage to surrounding tissues. Brachytherapy is used for a number of different tumors, such as prostate, brain, breast, and cervical. And there are many brachytherapy insertion sites, and these include the brain, eyes, trachea, lungs, esophagus, urethra, prostate, and breast. And there are some side effects, some long-term and short-term side effects to brachytherapy. Short-term side effects is the swelling, inflammation, pain, and bleeding. Patients generally recover from these, and they may also experience diarrhea, incontinence, and urinary tract problems. Long-term effects, however, brachytherapy may actually lead to the damage of the loss of functionality of vital organs, and there will be formation of scar tissue and potential fat necrosis, especially in breast cancer treatment. Now onto the imaging modalities, and there are three imaging modalities. That are mainly used for brachytherapy. These are ultrasound, MRI, and CT. And brachytherapy, the imaging is important because it allows for the identification and location of the tumor, and this allows for the insertion to expose the cancer cells to high levels of radiation whilst maintaining a low level of radiation exposure to surrounding organs and tissues. Now, the pros and cons for each of the imaging modalities. We're going to start off with ultrasound, and ultrasound is a safe and painless medical imaging, and it produces pictures inside of the body using sound waves, and this is done by having a small transducer or like a detector, and having that detect the pressure waves from the inside of the body. And the benefits of this is that it is a non-ionizing radiation, it is cost effective, and it provides real-time guidance and mapping of the area, and it's painless. However, results are hard to interpret, and if you increase the depth, it will lower the frequency and resolution of your image. Now, MRI. MRI is an imaging technique that uses magnetic fields and radio waves to interact with the water molecules in cells to obtain images of soft tissues and organs. And MRI is used in the guided prostate brachytherapy because it is able to identify lesions, like primary lesions and tumors. And this is done through the observation of the use of diffusion, of water diffusion. And high levels of diffusion is suggestive of cancer cells because healthy and intact cells have a much more restricted diffusion. And the pros of this is that it is safe, non-ionizing, non-invasive, painless, and has no long-term effects. However, the cons is that magnetic fields may disrupt medical devices, so like metal devices like pacemakers may be disrupted by magnetic fields, and some patients may experience allergic reactions to the contrast dye that's used. Now, lastly, CT. CT is basically a computer processing a whole bunch of X-ray images that were taken at various angles around the body and are giving you a set of images. And these images include images of bones, blood vessels, and soft tissues. And this is done instead of surgery, and it helps pinpoint the location of tumors and helps with planned medical and surgical treatments. Pros of this is that it is accurate and comprehensive, so it's easy to understand. It is painless and fast. Cons is that you are being exposed to X-rays of harmful radiation, and it is harmful and unsafe for pregnant women due to it harming the unborn baby, and it's also expensive. And now, finally, to wrap this up, Ultrasound is the most widely used form of imaging modality for seed guidance. However, there is research pointing towards MRI uses as an alternative medical imaging modality. However, due to the high levels of radiation and the restrictions of 2D imaging, CT is less likely used in comparison to ultrasounds and MRIs. That's it. Thank you for listening.